Hi there, Dr. Albert Wong here. I am the Director of Somatic Psychology at John F. Kennedy University. Really excited to share with you a new course that I'm teaching here. It's called Somatic Approaches to Trauma. So here's what we know about trauma. Trauma is not just a cognitive experience. Trauma is not just something that we can address from a cognitive perspective, because everything that we're learning about trauma, from the most recent advances in neuroscience, from research on the relationship between trauma and so many different bodily disorders and dysfunction, autoimmune disorders, digestive disorders, endocrine disorders, all of these things where trauma impacts our level of bodily stress, cardiovascular disease, all of these things, that trauma is not just a thinking thing. It's not just a prefrontal cortex disease. It's not just an error of executive functioning or cognitive labeling, and it cannot be solved simply by cognitive reframing, right? No matter how hard we try, because trauma is embedded into our system, okay? Trauma is a bodily experience, not just a cognitive one. And because trauma is a bodily experience, a somatic experience, something which impacts our amygdala and our heart rate and our nervous system, we cannot simply solve people's trauma issues through cognitive techniques alone. We have to address the body. We have to listen to the body. We have to try and help the body recalibrate on its way through trauma. Okay, so that's why I created this course, because there's so much lack of inclusion of a body perspective, a somatic perspective, and you can't treat trauma that way. So what this course is going to cover, we're going to talk about what trauma is from a somatic perspective, this notion of bodily overwhelm, what happens to the nervous system when your brain is experiencing trauma, what happens to your amygdala, what happens to your thalamus, what happens to Broca's area. So there's going to be a neurophysiological component to understanding what happens to your brain and what happens to your body when you're experiencing trauma. We're going to be looking at the distinction between the different kinds of trauma: shock trauma, developmental trauma, complex trauma, family trauma, cultural trauma, right? We'll talk about some of the major concepts that run through all of the somatic trauma literature: notions of titration, pendulation, somatic resourcing, grounding, centering, orienting, right? All of these are really important counterpoints to some of the other techniques that have been proposed out there. Fundamental notions like the window of tolerance. There have been certain kind of trauma methodologies proposed which endorse things like flooding and exposure. And while there is some truth and some value to those methodologies, if you don't have understandings of things like the window of tolerance or titration or pendulation to safely navigate the exposure that you're planning to do, there's a serious danger of re-traumatizing an individual rather than helping them. So we'll be covering all of those concepts in this curriculum. Some of what we are going to be covering as well are fundamental foundational notions of somatic psychology. First, what it is, where it came from, and this fundamental notion of the felt sense, right? What it means to actually feel into the body, into the place that has no words, this place that is this emergent process of something trying to come out of us, right? So listening for that felt sense, the somatic experience of what is on the edge of wanting to come forward. So we'll talk about the felt sense, the felt shift, using the process and learning the process of dual awareness, how to help somebody who's being sucked into a trauma vortex, right? Learn the process of dual awareness so that they can shuttle back and forth and hopefully return to safety when they're being sucked away in a world that feels dramatically unsafe. So this is a very full course, a very full curriculum, and a very important one. If you are a health professional who deals with trauma, a psychotherapist, a psychologist, a social worker, a marriage and family therapist, if you are kind of in a more strictly medical health profession but see people who have trauma, if you are a first responder, somebody who is a nurse, is a firefighter, is a policeman, is in the military, who sees combat trauma, right? Or if you're somebody yourself who has experienced trauma in your life, whether it's shock trauma or developmental trauma, actual trauma of commission or omission, abuse or neglect, right? Chronic or specific, right? This is a curriculum which hopefully could give you the language to help you understand some of what's going on for you, okay? So this course is intended to fill a gap in our curriculum, in the way that we train people how to deal with trauma. Trauma is not just a thinking condition, disease. It's not something that just impacts our mind. It impacts our whole body, our whole being, down into our trembling bones and our beating hearts and our sweaty palms. And it's something that we have to look at from a full body perspective. This is the course that will help you do that. Thanks for coming along for the ride. This is something that I care deeply about. If we can help people heal from their trauma, so much difference is made in individual lives, in the lives of our families, in the lives of our communities, in the well-being of our planet. So thank you for joining me, and look forward to seeing you in the next video. All right.